Welcome to the MRCS Bites session on acute appendicitis. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. What are the common clinical features of acute appendicitis? Acute appendicitis typically presents with abdominal pain, initially vague and located around the umbilicus, which then localizes to the right lower quadrant as the inflammation progresses. This shift, often described as migration of pain, is a classic feature. Patients frequently experience associated symptoms, including anorexia, nausea, vomiting, and low-grade fever. On examination, tenderness at McBurney's point, guarding, and rebound tenderness may be noted. Other signs include Rovsing sign, where pain in the right lower quadrant is elicited by palpating the left lower quadrant, and the psoas and obturator signs, which indicate irritation of nearby muscles by an inflamed appendix. Discuss the pathophysiology of appendicitis. Appendicitis is primarily caused by obstruction of the lumen of the appendix, which can result from fecaliths, lymphoid hyperplasia, foreign bodies, or tumors. This obstruction leads to increased intraluminal pressure, which compromises blood flow, resulting in ischemia. Ischemic damage to the mucosa permits bacterial invasion, causing inflammation, which further worsens luminal obstruction and pressure. As the condition progresses, the appendix can become necrotic and eventually perforate, leading to peritonitis and potentially a life-threatening situation if untreated. Inflammation often extends to the peritoneal surface, causing the characteristic localized pain and peritoneal signs in the right lower quadrant. How is acute appendicitis diagnosed? Diagnosis of acute appendicitis is largely clinical, based on history and physical examination. Laboratory tests, such as elevated white blood cell count with neutrophilia, support the diagnosis but are nonspecific. Imaging studies are often utilized to confirm the diagnosis. Ultrasound is useful, especially in children and pregnant women, where a non-compressible enlarged appendix with increased blood flow may be visualized. CT scan, however, is considered the gold standard due to its high sensitivity and specificity. It can reveal an enlarged appendix, periappendiceal fat stranding, and other signs of inflammation. MRI may be employed in situations where radiation exposure is a concern. In certain cases, diagnostic laparoscopy is performed when the diagnosis is unclear. What are the possible complications of untreated appendicitis? If untreated, appendicitis can lead to several serious complications. Perforation is one of the most common, which can occur as the inflamed appendix ruptures, releasing infectious material into the peritoneal cavity and resulting in peritonitis. Localized perforation may lead to the formation of an appendical abscess, which is a collection of pus around the appendix that may require drainage. Generalized peritonitis is a more severe outcome, potentially leading to sepsis and multi-organ failure. Another possible complication is the formation of an appendiceal mass, which can occur if the body attempts to contain the infection, leading to fibrosis and adherence of the omentum and bowel around the inflamed appendix. These complications emphasize the importance of early diagnosis and prompt surgical management. What are the treatment options for acute appendicitis? The standard treatment for acute appendicitis is surgical removal of the appendix, known as an appendectomy. This can be performed via open surgery or laparoscopically, with the latter being associated with faster recovery, less post-operative pain, and shorter hospital stay. In cases where the diagnosis is uncertain, diagnostic laparoscopy allows for both visualization and potential removal of the appendix. In uncomplicated appendicitis, antibiotics alone have been considered, but surgical intervention remains the definitive treatment to prevent recurrence. In the case of an appendiceal abscess or localized perforation, initial management may include antibiotics and percutaneous drainage, followed by an interval appendectomy after the infection has resolved. Prompt treatment is essential to prevent complications, especially in perforated appendicitis, where urgent intervention is required. For more MRCS Part B resources, please visit mrcsbites.com.